Thyroid Disorders by Brittany Pericaz. What is the thyroid? The thyroid is located in the neck just below the larynx, produces hormones that controls the rates of metabolic processes throughout the body. Two lobes of the thyroid lie on each side of the trachea. The thyroid hormone is regulated through a negative feedback loop, which involves the hypothalamus, the anterior pituitary, and the thyroid gland. It is initiated by thyrotropin-releasing hormone, also known as TRH. TRH gets released into the hypothalamic pituitary portal system, which then circulates to the anterior pituitary where the thyroid-stimulating hormone is stimulated, also known as TSH. TRH levels increase with exposure to cold, stress, and form decreased levels of thyroxine. Thyroid disorders include hyperthyroidism and hypothyroidism. Hyperthyroidism is an excessive concentration of thyroid hormones synthesized and secreted by the thyroid gland, characterized as low serum thyroid-stimulating hormone and elevated serum concentrations of thyroxine. Causes of hyperthyroidism include increased synthesis of thyroid hormones, excessive release of performed thyroid hormones, and Graves' disease, which is an autoimmune disease. Graves' disease is an autoimmune disease that arises from the loss of immunotolerance and the development of autoantibodies that stimulates the thyroid follicular cells by binding to the TSH receptor. Graves' disease, the immune system attacks the thyroid and causes it to make more thyroid hormone than the body needs. Signs and symptoms include nervousness, anxiety, heart palpitations, rapid pulses and tremors, muscle weakness, weight loss with increased appetite, heat intolerance, frequent bowel movements, and thyroid gland enlargement, also known as a goiter. Rheumatoid arthritis is most common comorbid autoimmune disease in individuals with autoimmune thyroid diseases. Risk factors include females, skewed inactivation of the X chromosome, vitamin D deficiency, selenium deficiency, thyroid damage, and immunodilating drugs. Diagnosis begins with serum TSH levels, a blood test, and it's the highest sensitivity and specificity in the diagnosis. Serum free T4 index, free and total T3 concentrations will also be measured. Treatment can be anti-thyroid drugs for hyperthyroidism, radioactive iodine, ablation, and surgery. All three options would be effective in the treatment of Graves' disease. Anti-thyroid drugs inhibit iodine oxidation and organification by hindering thyroid peroxidase. Graves' disease, the thyroid ultrasound and the thyroid radioactive iodine uptake have similar sensitivity for the diagnosis of Graves' disease. Advantage of the ultrasound is it decreases, or actually the absence of exposure to ionizing radiation and higher accuracy in the detection of the thyroid nodules. Progression of thyroid disorders is in Graves' disease. You can have the bulging eyes, also known as exophthalmos, and other immune systems events affect the muscles and other tissues around the eyes, causing swelling, edema. Occurs in about 25% of Graves' disease patients. Disease management begins with the anti-thyroid drug methimazole, also known as MMI, or tapizole. Polythyrouracil, P2U, those anti-thyroid drugs decrease how much thyroid hormone the body makes. Beta blockers, known as atenolol or propranolol, are used to treat some of the symptoms such as rapid heart rate, tremors, anxiety, and heat intolerance. Radioactive iodine destroys the thyroid radioiodine called ablation. Amount of radiation used is so small that it does not cause cancer, infertility, or birth defects. Surgery, which is a permanent cure, but used far less than often due to the risks, but they completely remove a thyroidectomy, removing your thyroid. Risk factors include damage to the voice box and parathyroid glands parathyroid glands. Surgery is recommended only if the large goiter is blocking the airway, or a patient cannot tolerate the anti-thyroid drugs and does not want to do any type of radiation, or if a nodule can be cancerous, and if there's any active exophthalmos eyes. Prevalence of hyperthyroidism worldwide, in Europe, 0 to 0.8%, 1 to 3% in the United States, and it purports to be higher in iodine deficient areas than in iodine sufficient areas. Patient education and when to call 911. Individuals must take medications as directed, follow up with an endocrinologist, which they study the endocrine system. Labs checked every 6 to 12 months. Super important to follow up on that to make sure that the levels are staying within range and to make sure that the medications don't need to be adjusted. Be mindful of the thyroid storm signs and symptoms, which include increased heart rate, blood pressure, body temperature. They can go extremely high and be fatal without any treatment. So if you're feeling any of those symptoms, you must seek medical attention as soon as possible. Hypothyroidism is another thyroid disorder, and hyper is excess, hypo is decreased amount. So causes is failed of thyroid function or failure of adequate TSH from the pituitary gland or TRH from the hypothalamus. Arises from a hormone deficiency. Primary hypothyroidism causes decreased synthesis and secretion of thyroid hormone, while secondary hypothyroidism is a disorder of the pituitary or the hypothalamus. 50% of cases is due to an autoimmune etiology, which is known as Hashimoto's. Signs and symptoms include fatigue, cold intolerance, dry skin, voice hoarseness, hair loss, weight gain, impaired memory, bradycardia, and sleepiness. Risk factors include women, increased age, family history, autoimmune disease, and any individuals that have been treated with radioactive iodine or antithyroid medications. So like I stated before, hyperthyroid, you can receive radioactive iodine or antithyroid medications, and there is a risk that you can become hypo instead of hyper. So meaning now your hypothyroidism, which your levels are out of range, but the opposite way. Diagnosis and treatment for hypothyroidism is similar to hyperthyroidism, includes laboratory measurements. It's TSH greater than 4.0. Treatment includes daily use of synthetic thyroid hormone levothyroxine, and which restores adequate hormone levels, reversing the signs and symptoms. Disease management. Therapy includes administration of the thyroxine. Daily dose depends on the weight, age, presence of coronary artery disease, and cardiac arrhythmias. During pregnancy, the dose required may be double. Prevalence of hypothyroidism worldwide, 0.5 to 1.9% in women and less than 1% in men. Prevention. Prevention for thyroid disorders, unfortunately, there is no prevention. You can only treat it, and it's not curable. So hyper and hypothyroidism is primarily due to an underlying autoimmune disease, which autoimmune diseases are not curable. So the medications that you may be prescribed is just to help produce more of the thyroid levels and help with any signs or symptoms that one may be experiencing to hopefully live as normal life as possible. Therapeutic measures. So normal TSH levels is 0.4 to 4.0 milli-international units per liter. Free thyroxine is 0.8 to 2 in adults. And TSH would be less than 0.4 in individuals with hyperthyroidism and would be greater than 4.0 in individuals with hypothyroidism. Referrals, evaluations, and coordination of care. So if you go to your primary care provider and they order some lab work and your thyroid autoantibody level or your TSH level come back a little abnormal, you will be referred to an endocrinologist who deals with the endocrine system to further evaluate the lab work and maybe order extra lab work. And I know when I went to the endocrinologist, I did like a swallow test so that he could feel the thyroid. I did an ultrasound to determine if I had any nodules. So other tests might be ordered per the endocrinologist. And if you're diagnosed in the hospital, an endocrinologist would see you, but you will follow up with one outpatient on your own. Barriers to adherence, lifestyle, psychosocial, and socioeconomic. So one must adhere to taking medications appropriately. It's important to take Synthroid every morning before you eat. Reporting any signs or symptoms. Barriers in life can be depression due to an autoimmune disease, knowing that it's not curable, that you have it for the rest of your life. Any symptoms that alter the way that one may look, such as a goiter, because the goiter can actually bulge out of the neck, showing that you actually have something there, so others may see it. Also, the exophthalmos eyes, which are obviously very visible to others. Individuals who might have that may feel self-conscious or depressed, or may feel some type of way if people are looking at them funny if they've never seen it before. So possibly seeing a psychologist or a therapist to deal with any depression or self-conscious issues. Also, any financial issues that may occur because doctor's appointments, hospital stays, and monthly medications. So doctor's appointments, an endocrinologist is a specialist. Not all insurance plans have great specialist coverage, which can be a little bit more pricey than the primary care doctor. So having to afford the doctor's appointment visits, any lab work, hospital stays can get pricey. So if you're diagnosed with any thyroid disorder in the hospital, or if you actually experience any fatal sign or symptom that we discussed and have to go to the hospital or call 911, that can also get pricey. And then monthly medications, depending on the type of insurance that somebody has, it can get pricey as well. So to seek financial assistance. Patient education and when to call 911 for hypothyroidism. So make sure you're taking your medications as prescribed. Also, this goes for hyperthyroidism. You want to follow up with the doctors, ask questions, know more about what's going on with yourself and your diagnosis. It may take time to determine the right dose and thyroid level. Get it checked every 6 to 12 months or as the doctor directs. And also call 911. If you have hypothyroidism and you experience any difficulty like breathing, any loss of consciousness, unresponsiveness, extreme tiredness or weakness, confusion, low blood pressure, that can be a sign of mixed edema, which is fluid built up in the heart and the lungs, and the tissue begins to swell, which is fatal, and you need to seek medical assistance as soon as possible. And when I say follow up with doctors and ask questions, I was diagnosed with Hashimoto's not too long ago, but I should have been diagnosed 2 years prior to my diagnosis. However, my doctor gave me the wrong diagnosis. And at the time I was in high school, I think maybe freshman in college, sophomore in college. I didn't ask questions. I wasn't interested in finding out more. And if I had found out more, maybe I would have had the right diagnosis from the time I left the doctor's appointment. So make sure you're asking questions and knowing your care and follow up on your own care. Evidence-based treatment. So there are tons of evidence-based treatment regarding thyroid disorder medications or any other treatment that one may experience, as well as very current research that's going on all the time for levothyroxine or anti-thyroid drugs. So some of the articles that I had looked into, one of them is called Association Between Levothyroxine Treatment and Thyroid-Related Symptoms Among Adults. So patients were randomly assigned to receive levothyroxine, and the second group were getting placebos. They took a questionnaire to determine the quality of life while receiving the placebo or the levothyroxine, and as the time went on, they'd fill out the questionnaire based on their signs and symptoms. The placebo group, the tiredness increased from 12.5 to 28.2, while the group that received the levothyroxine decreased from 21.7 to 19.3. Granted, it might not seem like a great decrease, but if you look at the tiredness at 28.2 to the levothyroxine group at 19.1, that is a big gap. So it is showing that the levothyroxine is actually helping the signs and symptoms of hypothyroidism. Article 2, Management of Primary Hypothyroidism, Statement by the British Thyroid Association Executive Committee. So levothyroxine reflects best practices. They did research and it reflected the best practices in management of hypothyroidism. Safe, rational, simplified approach to the correction of hypothyroidism. Treatment showed improved physical and psychological well-being. So getting those levels of the TSH up can actually help an individual, because then the signs and symptoms that they're experiencing are becoming less and less, allowing them to live in a normal life if they're not so tired, or they are, experiencing any of the other symptoms. Article 3, so anti-thyroid drug therapy 70 years later, which goes along with hyperthyroidism. And hyperthyroidism, they found that radioactive ablation, anti-thyroid drug, and surgery does have potential lethal outcomes. That's a given, yes. But those are the preferred treatments in most parts of the world. So they've done research to show those treatments are actually the most beneficial. Obviously, depending on the patient's situation and the patient's diagnosis or signs, symptoms they're experiencing, like I said, it's per patient, not for everyone who has that specific diagnosis, but definitely per patient based on the doctor's assessment and the patient's signs and symptoms. Article 4, the history of the future of treatment of hypothyroidism. TSH is can lead to dramatic reduction in thyroid hormone replacement dosage and the ability to diagnose with certainty milder forms of hypothyroidism. So receiving the TSH is actually allowing those TSH levels to return to normal, and it allows for milder hypothyroidism to, it allows for the hypothyroidism to kind of reverse in the time being, not cured because you still need to take the medication, but it helps the patient live a normal life they've found. And it's perceived to be the most reliable therapy for hypothyroidism. Article 5, a second course of anti-thyroid drug therapy for recurrent Graves' disease and experience in endocrine practice. So they're recommending that the anti-thyroid drug therapy of patients did not find any evidence of relapse. So they looked at patients who the Graves' disease they had like a relapse in their care, I guess you could say, but the anti-drug therapy did not show evidence of relapse with hypothyroidism. It actually, getting a second round of it actually helped the patients with Graves' disease. So, like I said, these evidence-based treatments are very well studied, and all these articles are very current, 2019, 2015, 2018, 16, and 14. So they're showing that these are current, these are evidence-based treatment for these thyroid disorders. Thank you.